name's Elizabeth Goodall. I'm a haematologist and early career researcher at Austin Health, the Olivia Newton-John Research Institute, as well as Monash Health in Melbourne, Victoria. I decided to do a medical degree after finishing my Bachelor of Medical Sciences and honours and moved to Gippsland to complete medicine. Then moved around Melbourne doing my postgraduate medical qualifications and decided on a career in haematology. I then moved to the Austin Hospital where I completed all of my haematology training and then have completed a clinical trials fellowship at both the Austin and Monash Health. I'm now very interested in moving into an academic research field in combination with clinical work to improve my academic and research focus and interests in lymphoma. The areas of research that I'm about to embark upon is a PhD and clinical project on patient-reported outcomes and how patients experience their treatment and their illness throughout their diagnosis of lymphoma in particular. I'm interested in all parts of haematology, but particularly malignant haematology, and most particularly after 3 years of experience in the fellowship, I'm very interested in how patients experience their treatment and how they experience the side effects from the treatment that they are given by their clinicians. I think this is incredibly important to be able to tease out, as often it is overlooked, and I'd be very interested in moving forward in my research to be able to get some granularity around this to improve outcomes for patients with lymphoma. The PhD is a 3-year project and it is funded by the Haematology Society of Australia and New Zealand and the Leukemia Foundation. I've been very lucky to be awarded a scholarship in this field, which is a 3-year scholarship project and is funded throughout the 3 years. The project will take a component of 3 separate parts, the first of which will be looking back with a systematic review across at least 20 years of lymphoma clinical trials research and the patient-reported outcomes data that has been obtained from these projects, where it has gone, where it's recorded, how it is recorded across all of these clinical trials, as there's a lot of heterogeneity within the recording of these data, and I'd really like to look into why this is, where is the data, and can we do this better in the future. There will then be a deep dive into the PROMs, which are the patient-reported outcome measures or the tools that are used to record the patient data, looking into why they're chosen for different studies, are the PROMs used for each study appropriate and the reasons why these are chosen, and getting a medical or clinician view over all of this data, which is less common as this is often looked at from a different craft group other than just medical specialists. So there will be a different view of this, and then the final component of my research across the 3 years will be looking into whether there can be improvements and recommendations into a governance structure or framework across future reporting to try and improve the patient's voice in the outcomes of research and the delivery of treatment across lymphoma treatments into the future. Passion has come from many years of both basic science research, becoming interested in where the research goes, the translation of basic sciences, which is an incredibly important part of design and development of medications, but then I have a particular interest in the patient-centred part of clinical research. I have done bench work and science in the past, and I'm still very interested in that, but the translational component is where my passions lie. I'm a clinician who's very patient-centred. My skills are in talking to patients, trying to get what the medical jargon and translate that into something that patients can understand and relate to. We demand a lot of trust from our patients when they have no choice in the matter, and I think it's absolutely essential that we can get that information across to patients and see that they understand what we're asking them to do as we're putting a lot of faith in them as our patients. I've fostered a huge amount of passion for treatment of lymphoma over the 5 years I've been doing haematology now, and I would really like to build on that with my clinical research and be able to improve patient outcomes into the future. I have quite a lot of interests outside of work. I'm very passionate about photography, travel, journalism. I like to combine all of those with as much travel around Australia and the world as possible. I've been to a lot of countries, both developing countries and developed countries across the world, and love taking photos of both people and environments and buildings and animals and nature, and try and use that to explore Australia as well, my own hometown. And I like to get out in a caravan and spend time out in nature and do hikes and bushwalks and take my camera wherever I can go and document whatever I'm doing to look back and have those memories. I also quite like craft and needlework and mindfulness after a long day, and I enjoy spending time with friends and having as much coffee as possible whenever possible.